Wellington is on high alert after a confirmed COVID positive case travelled to the capital from Sydney. This has all been confirmed by authorities just in the last 60 seconds. The news came hours after the pause in the travel bubble between New Zealand and New South Wales. So for the very latest is AM show reporter Lauren Hendrickson. Lauren, you've just received some information, some fresh information. What do we know?
Yeah, well, moments ago, the Ministry of Health has just released a press statement confirming this information, that a passenger with the highly infectious Delta variant flew into Wellington out of Sydney on Friday night and returned on Monday morning. Now, this news originally came from New South Wales health officials, but the Ministry of Health has just released a statement confirming this. Now, anyone who were on those flights, that is QF163 and NZ247, are being told to get a test immediately and to isolate for 14 days, regardless of the result. And based off Australian health advice, people on those flights may be considered close contacts. But the Ministry of Health, in their statement that they have just released, they've identified so far 4 close contacts. Work is underway to try and identify any locations of interest and to begin contact tracing. But so far they have confirmed 4 close contacts and more will be identified soon. But this news came just hours after the quarantine-free bubble with New South Wales was paused. That will be paused for 72 hours and will be under constant review as Australian health officials work to identify the source of a community outbreak in New South Wales. But interestingly enough, at the same time, the pause on the quarantine-free travel with Victoria was lifted.
Okay, so what we know then is this person travelled to New Zealand, to Wellington in particular. We don't know where this person went, where they partied up a storm, if they did it all, or if they sat in a room on their own for 72 hours. Who knows? I doubt it. So they've gone somewhere, they've seen people, they've mixed with people. We just simply don't know how far and wide this may have spread. We don't know if it's spread at all. So those details will come when? Do we know?
We don't know. We are expecting an update from the Ministry of Health later this morning. They have just said in this release that it is most likely that the person contracted the virus in Sydney prior to their travel to New Zealand. But I've just spoken with Auckland University medical professor Des Gorman, and he says this is a serious concern. And he also said there is a chance of a significant outbreak after this news. But he said the main problem, as you were just saying, is that we don't know where this person has travelled in Wellington, how far they have gone, who they have come into contact with, and how infectious they may be. So he says aggressive contact tracing needs to get underway so we can identify some locations of interest and people can get isolated, can start isolating as soon as possible.
That is for sure. That is what's needed. Good stuff, Lauren. I appreciate your time on the program.